Now that's not, I'm not trying to impeach doctors or medical doctors. As a matter of fact, that's the last thing I would want to do. But they do not have the time, especially primary care. So part of our quest in our evolution as professionals should be how to become integrated in primary care, hence concepts such as integrative medicine. How do we, as clinical psychologists, become part of primary care? Jack Wiggins in Arizona is a major proponent of having psychology be part of primary care. Nick Cummings in Nevada and Arizona, same. As a matter of fact, Nick Cummings developed a program in the 70s, not a program, a practice, where he used the Kaiser model to develop the first psychology HMO. It's called Biodyne. And Nick just transferred his knowledge from what his experience was at Kaiser, which, by the way, he did the research, and what he found out is that patients who were triaged by a psychologist had significantly less visits to the physician, had significantly less medical complaints. They just wanted to be listened to. They just wanted to be able to talk to somebody, to have somebody listen to them. Lots of these patients develop these symptoms because they're not getting their needs met at home, or they're not getting their needs met at work. It's not that they have physical illnesses, they have physical symptoms. So Nick decided, well, okay, let's look at this. Created a whole practice based on that notion. Did very well with it. I think he sold it for several $1 million. 14. That's several. So you see, if you understand who you are and understand what your skills are, and you start looking at how do I generalize these skills to other individuals, groups, communities, you can do the same thing. We have several programs in several arenas around the world. I looked at this initially as, how do I impact individuals? How do I impact groups? How do I impact communities? And it got to, how do I impact countries? Because I was able to work with the Ministry of Health of the country of Nicaragua. And it eventually got it to a point before their political upheaval where we were going to be able to impact a country by bringing health care to a country that didn't have the type of health care that they required.